Welcome to the H.D. Smith Pharmacy Podcast Series, recorded live at the NCPA Annual Convention and Exhibition in October of 2017. This podcast series is dedicated to independent community pharmacy owners throughout the country, and the topics and discussions are near and dear to the H.D. Smith team. H.D. Smith is the only national drug wholesaler dedicated exclusively to independently owned pharmacies, and has been since 1954. H.D. Smith's consultant-style proactive account management helps pharmacies thrive and improve profitability in today's changing market. Share all these podcasts in this special series about topics and issues impacting the profitability and survivability of privately owned pharmacies with other owners and operators. Help us spread the word about supporting independently owned pharmacies. And now, here's the founder and host of the Pharmacy Podcast Network, Todd Eury.
Hi, this is John Beckner with NCPA. You're listening to the Pharmacy Podcast.
Hey John, welcome to the Pharmacy Podcast. My name is Rob Meriweather. I'm the Corporate VP of Sales for H.D. Smith. And I have the great pleasure of hosting this Pharmacy Podcast today, and the great pleasure of being with you, John.
Great to be with you, Rob.
It's been a great conference here at NCPA so far, huh?
Glad you've enjoyed it. Attendance is good, a lot of energy.
A lot of energy.
A lot of excitement around CPE SN.
I agree. And CPESN, remember those acronyms? We're going to touch on that just a little bit later here. What I wanted to do with John today is walk through some of the findings that NCPA gathers every year. They go out and conduct an extensive survey of pharmacies and encapsulate a lot of the data in terms of where pharmacies are in the market through what they call the NCPA Digest. And many of you may not know, but community pharmacy is almost an $80 billion market, billion with a B. And I want to walk through some of the important characteristics that make up pharmacy today. So John, can you walk us through how you would consider the state of the union, the state of the industry to be today in terms of whether or not stores are growing, how are they doing from a profitability perspective, and what you see as the immediate future for folks to tackle this space?
Great, Rob. I appreciate the opportunity to be with you here today, and you touched on the NCPA Digest, and that document is really an important barometer for us, for our members, to really kind of gauge how they're doing in the marketplace. It measures them against each other, measures them against the chain arena, and it really is a good way for them to see how they're doing. And if you look at, and we can get into the specifics of the digest, but when you look at the digest in summary, I think the numbers tell you that independents are really expanding their services. They're providing innovations to optimize medication use. They're doing all these things to really combat declining reimbursements.
You know, John, NCPA has long been an advocate, the advocate for community pharmacy. And one of the most important, what I will call revelations over the last couple of years is something that you guys have gotten behind called CPESN, which stands for Community Pharmacy Enhanced Services Network.
Right.
Will you explain to our audience what CPESN is all about? What are its objectives, and how can someone listening get involved in this very, very important initiative for community pharmacy?
CPESN is an extremely important initiative for not only NCPA but for our members across the country. It actually started down in North Carolina as part of a grant from CMS, and the group in North Carolina has partnered with NCPA to help expand the network concept across the country. And it's really all about getting pharmacies into networks that provide a core set of services. And many of these services are actually measured in the digest. But the overarching goal of a network is to be attractive, be a source of referral to not only the provider community, physicians, but also a source of referral for payers. So again, to position these pharmacies that are part of these networks to be attractive to payers and hopefully successful for the long term.
Yeah, so John, what I've seen is that obviously what pharmacies are doing today are the same things they did 5 years ago, and they're no longer being recognized the same way from a compensation standpoint that they used to be. Right? Everyone's struggling from margin pressures. The digest suggests that gross margins for community pharmacy have gone down for, I believe, a third straight year. They're now just above 22% gross margin. And CPESN is looking at ways to differentiate the services that most community pharmacies already provide,
right,
but probably don't get the recognition or the compensation for. Can you walk through a couple of the enhanced services that CPESN would consider? Exactly. That stores would be performing today, right, that become part of this network?
And Rob, I think you hit on a great point. I think a lot of these pharmacies have been providing these services for a long time, but just not necessarily recognized for them. One of those is immunizations. Immunizations have grown steadily with NCPA member stores for the last 5 years. In fact, from 2015 to 2016, they were up from 67% to 74%, which is a significant number. Other services that are actually core services in these CPESN networks are medication synchronization, adherence packaging, medication reconciliation, and actually prescription delivery. And in addition to these core service sets, these pharmacies that are part of these enhanced services network can also offer optional services such as point-of-care testing, health screenings, things of that nature.
So the point here, John, is that it's no longer good enough to simply lick, stick, and pour. It's important as vital and pivotal providers in the community that we as the community of independent pharmacy need to make sure that the health system is taking notice of everything that we do to help make patients become healthier and more active people.
No question about it. I think the lick, stick, and pour mentality is, I've heard the expression, a race to the bottom. It truly is a race to the bottom if you don't provide differentiated services that have value not only to payers but really to patients. I mean, you want to be providing value to patients to be able to optimize outcomes. And one of the premises behind the Enhanced Services Network movement is that these pharmacies not only impact pharmacy cost, but they impact total healthcare cost. And that's the part that's of value to the payer.
And of the total healthcare cost, I've seen reports that prescription coverage is only about 10%.
That's exactly right.
Of the total pie.
Right.
And the reality is that the services provided by community pharmacies can actually have a greater impact on the 90% of healthcare spend that's so important to reducing what's been a challenge in this country.
That's exactly right, Rob. And when you look at the independent community pharmacy marketplace, many of these stores are in rural, underserved areas where these pharmacies, these pharmacists are the face of healthcare. And being the face of healthcare, and because of the relationships that they have with their patients, they can really have a significant impact on their health and total healthcare costs.
Yeah, John, I'm going to read a couple of stats here from the digest that are pretty revealing. 87% of community pharmacies provide MTM services. Probably not a surprise. There are some stats in here that I think are pretty telling. 9 out of 10 community pharmacies provide medication adherence or sync programs today. I think that's been a really important and aggressive movement in community pharmacy that will pay dividends for patient compliance and adherence. 7 out of 10 provide some kind of prescription delivery. 6 out of 10 provide blood pressure monitoring. 3 out of 4 provide immunizations that you touched on earlier. So, John, I think what's exciting for me is that we are at a point in the evolution of the community pharmacy market where we are finally allowing ourselves to take notice and take credit for the care that we provide to the patients in our communities. And it's been a pleasure working with NCPA as you guys drive this recognition and this evolution for people to take part of. So if you would leave our audience with a parting thought from the NCPA Annual Convention 2017, what would you like this audience to hear?
I think, Rob, this is my fourth NCPA convention, and compared to 4 years ago, the energy level, the optimism that has pervaded the exhibit hall and all of our educational sessions is really palpable. I think pharmacists our members are finally realizing that they need to embrace change. They need to embrace providing additional patient care and clinical services in order to be successful. And I think they want to do that. They want to be part of the healthcare solution. And that's very exciting to see, and I think it's pretty evident here at our meeting.
Yeah, I love the term embrace the change, and one of the keynotes from this week, your current president, Deanne Mullins, made a statement that if you aren't growing, you're dying.
Exactly.
And what's been exciting for me at this convention is that there are literally dozens of ways to promote store growth. Now that may mean physical count of your stores,
exactly,
or it may mean simply enhancing what you do in your store,
exactly,
to be recognized in different ways, either from the payer community or from your patient base. And that's been re-energizing, no doubt.
You're going to see a combination of that. I think the average NCPA member owns a little bit less than 2 stores. I think 1.9 is the number from the digest. I think looking ahead to the future, you're probably going to see that number go up as hopefully these folks continue to be successful and sustainable. But you're also going to see folks that have single stores expand their offerings. If somebody's doing immunizations, they may expand that to offering travel. They may expand their opportunities in the adherence arena. So I think you're going to see a combination of that as the CPESN movement continues to gain momentum and expand throughout the country. And I'll tell you that it's so exciting to have, and we're going to continue to fight the good fight on the advocacy front, but we can also battle the PBMs and the DIR situation with positive things like CPESN.
Yeah, I agree, and I will say that as an H.D. Smith associate, H.D. Smith has been advocating for independent community pharmacy for the past 60 years, and we're excited about some of the things that we're doing to tackle this market. If you're looking for help with immunizations, we're one of the leaders in delivering flu and other vaccines. We have programs to help transition your store or to grow your store count. And we have a 5-point program to help manage your profitability around what we call the winter wheel. So no doubt there are plenty of challenges, but also no doubt it's a great time to be part of what I consider a new movement. And if there's one common theme that I take away from this meeting, it is CPESN and all of the things that community pharmacies need to be doing inside that evolution to maximize their future. So, John, thanks for being part of the Pharmacy Podcast today, and thanks for all you do for pharmacy.
Same to you. Appreciate the partnership. Thank you.
Absolutely.
We thank you for listening to the H.D. Smith Pharmacy Podcast Series, recorded live at the NCPA 2017. To learn more about topics impacting the independent pharmacy community, be sure to listen to all the podcasts in this 12-part series. As a reminder, H.D. Smith is the only national wholesaler dedicated solely to independent pharmacy owners. H.D. Smith's success is directly related to the success and profitability of privately owned independent pharmacies. To learn more about H.D. Smith, visit hdsmith.com.